Welcome to the Extraordinary Health Podcast from All Seasons Integrative Health with your host, Dr. Paul Bekkum. We're here to find the root cause of your health condition and help you to finally feel good again. At All Seasons Integrative Health, we utilize full-body chiropractic care and the latest cutting-edge physical medicine therapies, as well as functional medicine to help you live your full potential.
Hello, this is Dr. Victoria Lau, and with me, as always, Dr. Paul Bekkum.
Hello.
And today we are discussing rotator cuff injuries. The good, bad, all in between, and how far they can go and how worse they can be.
Yes, that's quite the subject. Rotator cuff injuries, yes, are... especially this time of year, you think of sports like baseball where, rotator cuff injuries are fairly common. Also, you get construction workers are probably, the next highest or one of the highest areas of injuring a rotator cuff. The average individual can have it happen as well. I think the statistics show that there's like 2 million people in the U.S. every year will have a rotator cuff injury. But that's where, hopefully, especially if we have athletes or something like that, we're getting them in here beforehand and, doing some screening tests so we can determine, do they have some, what I would call just inhibition of the muscles there. Some people, when the athletes come in themselves, they're going to think that, oh my goodness, it's weak. And yes, that might be a case, where they need to do some rehab with it, and that would be included with, what they need to do themselves. But a lot of times it's because either they have some bad mechanics that's causing some stress on one of the 4 rotator cuff muscles, and we should probably get into all those as well, just so we cover all of them there. The main one in athletes that usually gets injured, especially in a baseball setting, is the supraspinatus rotator cuff muscle there, even though they're all attached into the same kind of big musculotendinous, I think aponeurosa would be the big fancy word for it there, but just connective tissue that's then attached from the shoulder blade out to the greater tubercle of the humerus. And when a person strains one of those muscles, that's when you're going to start to have some, weakness or inhibition show up. Myself, I know when I've watched, baseball pitchers, you can start to tell, when their rotator cuff really starts to go because they start to lose control of their pitches. And even when you go to, rehab a rotator cuff injury, you really don't want to use much more than about 8 pounds of resistance there to work those muscles, because if you get anything that's heavier than that, you're going to start to kick in some of the bigger muscles that we don't want working at that point in time, like your pectoral muscles, your deltoid muscles, your biceps, your triceps, even some of the stabilizing muscles for the shoulder blade itself, like the lat muscles, the serratus anterior, rhomboid muscles. Sorry, I'm listing off a bunch of muscles here, but those are all the things that can get strained more in a bigger sense there. But by keeping the weight or the resistance down, if you're using resistance bands, you're going to be able to more specifically rehabilitate the rotator cuff muscles. So I don't know, what have you seen kind of with patients with shoulder injuries?
Well, I definitely like how you brought up, resistant bands. I've definitely seen that utilizing those for strength training of the sits muscles or the rotator cuff muscles, we've seen greater quality of their exercises, just to, like you said, reduce the use of the larger muscles that start working along the lines if you start pulling in big weights and things in that nature. But that makes perfect sense. And, for the lay individual, maybe they don't know that. And that's where we can come in and determine what is best for care in that nature there. And baseball, football, golf. How often would you say do you see a normal just overuse, wear and tear of, say, an individual as they age with rotator cuff?
It's going to depend on the activities that they're performing.
Mm-hmm.
Again, if they're an athlete or something like that, that is continuing to play something like softball or something like that, if they're not stretching those muscles out, if they're not even doing any, prehab would be the best term, and, strengthening those muscles up before a season so that when they get into a season, they're not going to end up having tears, or strains of those muscles. So again, if you're not doing what you probably should be doing to get ready for a season, just because, hey, I've done it for 20 years now, and all of a sudden, you end up with a, tear of the rotator cuff, it doesn't necessarily mean that you need to have surgery, because some of these will actually heal up with some of the therapies that we have in the office, and you could have a pre and post, MRI of it there and see that it's actually healed up. If the tear gets to be too big or something like that, then yes, you're going to have some orthopedic surgery done there to help reattach, the rotator cuff itself there to the head of the humerus. That's typically where it gets injured. But yeah, getting back to some of the athletes here, obviously the younger you are, the more you can get away with. The older you get, the more your body, for the best term, kind of dehydrates, is maybe the simplest way of thinking of it there. If you're not getting enough water, enough electrolytes there, your body's just going to be, a little bit more brittle, and as you go to do some of these activities, you're going to end up having, more and more issues with muscles and tendons and connective tissue there, even like the ligaments around joints and all that. So, again, that's some things where we can put people through some testing in the office here. We can even find out, what are your hydration levels here? Do you have enough intracellular, hydration? Do you have enough extracellular hydration? What is your hydration levels overall here? Sometimes I just had a patient the other day. Hydration levels overall, good. Intracellularly, horrible. I mean, like off by, they're in the low 20s, and they should be, and again, it depends, male, female, should be up in the 30s, so almost 10% less than what it should be inside of the cell. And then here they had too much extracellular fluid, so we have to be able to take and use some different supplements to help correct that. I mean, we can use creatine, seems to work really, really well for these patients, and we find that then, if they had too much extracellular fluid, the creatine helps to get that fluid into their cells so it can be utilized, just to help keep their cells more pliable. I mean, that's going to decrease the risk of injury there, but it's also going to help the cells communicate better together, to even heal better too. So,
Yeah, I don't think most people know intracellular water.
Yeah, and it's with some of the equipment that we have. I mean, we originally got it for helping patients with neuropathy, and I would say 99% of them have decreased intracellular water. I mean, there's a few that we've had that have been okay, but the vast majority of them, that's where they're having some problems. And we'll give them supplement recommendations to help correct those. I just found a company who has 3 different supplements for patients that do have neuropathy that we'll probably be starting to use in the office here, because it's attacking the 3 most common things that people do have wrong as far as from on a nutritional basis, to help correct neuropathy. We still need to do, some of the in-office treatment, using some of the lasers we have, shockwave treatment, PEMF therapy, things of that nature, to help with, getting the fluid or water into the cells again. They're helping the tissues to, we're exercising the cells with the PEMF therapy there. It's also putting a charge on the cells, like the piezoelectric effect. So that helps the tissues to heal up and even repel each other so they don't stick to each other like red blood cells. So that helps to get better nutrients and oxygen out to the tissues there for things to heal up. But now we're getting a little bit further away here from our rotator cuff injuries here. But getting back to the rotator cuff injuries, let me just kind of cover all the different muscles that we're really looking at. There's 4 muscles in there. 3 of them do external rotation of the arm. That's the supraspinatus, your infraspinatus, and your teres minor. And then you have one that does internal rotation, which is your subscapularis muscle. And I will find a lot of people where that subscapularis muscle is getting overused a bit. They're doing jobs, and this would get into probably the weekend warriors where they're going out and doing sports on a weekend or something like that. They maybe have a mouse that they're using at work or something like that. That typically overstresses that subscapularis muscle. And they'll end up getting some weird numbness and tingling sensations going down their arm. But once we get that addressed, and usually we're using some different therapies. It could be a combination of a therapeutic ultrasound with an electric stim. But I think what really works the best now that we've had it for over a year and a half is our focused shockwave therapy. Because that'll get in there, that'll help that tissue heal up. It'll decrease the inflammation in it. It'll decrease the pain. It'll even help stimulate, the stem cells in there for that tissue to become more pliable. Again, add in some of the supplements that help out with that. And we can get that tissue back to almost a normal state. And typically, once we've treated it with the focused shockwave, once we get it better, it should stay better unless you go and aggravate it again. So.
Mm-hmm. And I can speak from experience, but that subscapularis, when that gets inflamed, and you like to poke on it, that does not feel well.
I mean, the subscapularis can have a trigger point in there, and they'll call it the hidden culprit. Mm-hmm. It's because that muscle sits on the front side of your shoulder blade, and there's not too many people that are going to go into your armpit to work on a muscle.
Dr. Bekkum will.
But, if that's the problem, then, we need to get in there and, get that worked out so that we can not only, most of the time they have trigger points in them, get that trigger point knocked out. And trigger points go from being active. So if you had numbness and tingling in your arm and we work on it, it makes it worse. That's an active trigger point. You might come back your next visit, you're like, it's doing great. I don't have anything going on in my arm. And then we start working on it again. You're like, oh, you just made it worse again. It's going down my arm again. That's called the latent trigger point. We still need to treat that there until we get to, they would just call it a tender point. So you might come in on another visit and it might just be tender to the touch, but it's not causing that referred, pain symptoms like it did before. Then we're typically done treating that there. But we're going to have people doing some exercises to help strengthen everything up and stabilize it so that, again, long-term it doesn't come back. And that's where utilizing either, like I say, a combination of an ultrasound with an electric stim to help knock that out, or the focused shockwave is super helpful in, reducing that. And I would say the shockwave works a lot faster than just using, the therapeutic ultrasound with electric stim.
Mm-hmm. Now, I was just thinking here, most, say an athlete injures a rotator cuff, they're probably going to go in, maybe see their medical doctor, maybe get referred to some physical therapy. Where in that step process, should a parent or an individual say, hey, yeah, physical therapy, yes, it's there and it does a thing for what it's needed, but when would we step in, or should a parent step in and say, hey, let's try this out, maybe in combination with physical therapy?
Yeah, I would say, for most people, I guess the best way I can describe what we do in the office, it would be more functional physical medicine. So if they could get in here right away, and yes, they might still need to, utilize some of the different medications, at least initially, just to make it tolerable so you can sleep. Especially if you injure a rotator cuff muscle, it can be uncomfortable to sleep, and you might not get really good rest, because if you roll over on it, it gets sore, it wakes you up. You can try and sleep on your back, you can sleep on your side, but, and if you add anything else on top of it, like a dislocated shoulder or a AC separation or something like that, initially we got to get that pain down and inflammation down, and if you have to use medications for that, you're going to have to use some medications for that. We have therapies that can help out, but it's, probably not going to make it disappear right away there. We will try and get it supported properly with utilizing different things, maybe like kinesiology tape or, putting a brace on it if necessary. But working in conjunction, I think you're going to realize that you're going to probably heal up twice as fast if we get in there and start working on it right away, rather than, waiting for it to quote unquote heal. In a medical sense, that means that you don't feel any pain anymore, or there's little pain left. And that's, pain is the first thing to show up, obviously, in an acute injury, where you tear something or anything like that. You've torn the tissue there. You've irritated the nerve fibers that will give you the pain sense there. And you might have caused some damage to some of the mechanoreceptors that are in the tendons or in the muscles, which are the nerves that, or the nerve end organs that are going to those tissues. And, you need something to kind of quiet that stuff down. Sometimes we can even do that with some supplements. You can get in there and utilize things like curcumin, which comes from turmeric. You could also be using other supplements like NAC, which that can help a lot with decreasing inflammation. It's a good thing for detoxing things. You could use some proteolytic enzymes that help to reduce the inflammation as well. It's probably not going to be quite as strong as, some of the medications that they have, but hopefully the biggest thing is to try and avoid even things like cortisone shots, because cortisone shots go in there and they eat up the tissue. And, luckily now they usually limit it to 3 shots of that. In the past, they'd keep doing it, and it just eats away at the tissue, and it's just never going to be normal again for a person. In fact, I know an individual who played football in college, I think back in the 70s there, and gosh, he had his knees replaced when he was in his 30s because he had so many cortisone shots put in his knees so that he could play the game that day, that it just ate away all the cartilage in his knees, and it was just gone. That was before they only said 3 shots. And like you might find surprising, like I would say our focus shockwave is going to be very, very close to utilizing something like a cortisone. Cortisone, you got to make sure you get it into the right tissues, and hopefully they have a good way of knowing of where they're getting into. They might use a diagnostic ultrasound or something like that to guide it into right where there's a tear or something like that. But that's the nice part about using our focus shockwave. We can do it in a diagnostic sense. We can run it over the area where you have a tear or something like that, and you're going to be able to feel it. And we're going to, want to run that so you're feeling pain, not on a 10 out of 10 scale where 10's unbearable, but more 4 or 5 out of 10, just so that we know that we're hitting the right tissue there. And typically people get at least a 50% pain reduction. A lot of people, though, get 80 to 90% pain reduction right away using that focus shockwave on it. So
that shockwave is very interesting. How we talked about trigger points, and you use it and you hit that active trigger point and you're going to get that referral.
Or you get these areas, like if it is a torn rotator cuff, you're going to, when there's inflammation there, you're going to know it. It's literally going to be like, oh yeah. And it'll give you a little bit of referred pain. You should feel it in the area where you've been feeling pain. Once we hit those spots, that's what we want to continue to work on there until we get it knocked out. So typically, it'll probably last a day or two the first time we run it. We can run the therapy, a couple of times a week, maybe 3 times a week if we really wanted to kind of push it a little bit here. Should have at least about a 24-hour period of time in between at a minimum to run this therapy. But, once you have had it done once, you're going to know that, okay, yes, that really helped take care of the problem. And, we'll let you know what it costs, because unfortunately, Focus Shockwave right now, insurance companies just aren't paying for it. Some do, but the vast majority of them don't pay for it right now. So,
No, I appreciate all that. I know for myself growing up, my first stop wasn't always, let's get to the ER, let's see what happened. It was my chiropractor. We had a chiropractor. He would come to my house, sprain an ankle, he'd check it out and take care of it. So that's, I think, to reiterate that at our office, we do have so many modalities and so many therapies and so many options for care that, yeah, maybe physical therapy is one thing in one place, but what we have in conjunction with that can certainly get you moving in the right direction, and even faster too.
Yeah, I'd say, most of the therapies we have in the office, are, I think, the combination of what we have, you're not going to find anywhere else in the Fargo-Moorhead area here. And they're cutting edge stuff. So yes, some of them aren't going to get covered by insurance, but we always let people know how many treatments we think they might need, how much it might cost, so that you're informed ahead of time here, so you're not going to be surprised with a big bill in the end or something like that. You're going to know as we go along here, and you're going to be able to feel that, hey, you're getting better with this here. And even the tests that we do with you, you can see that those tests are getting better as you go along with treatment here. I just find it interesting now that some insurance companies don't want to pay for things so that we can show that you're actually getting better here. So I'm assuming that they're going to just allow us to continue to treat you until we get you resolved here, and they're not going to have any questions as to whether or not we're getting you better or not here. But it's crazy to me. But
I think one step to note too is that we do have X-ray available. So if there is an injury that you're questioning, that we can certainly do an X-ray right here at the office too.
Yeah, and we can rule out things like fractures. Some people can get a little bit of possibly bleeding in the area there, and then they can start to develop, like some calcification of those tendons, ligaments in the area there, and that's where we're going to want to get on that and be pretty aggressive, utilizing some of the therapies. Ultrasound works really well at breaking that stuff up. The Focus Shockwave would be something that would be super helpful with that as well. So as far as anything, from, like I say, a functional physical medicine kind of standpoint, we have almost everything we can possibly have here. I think there's a few things I can think of, but they're used in really rare or odd situations that we don't really see a ton of here, like something they used to call reflex sympathetic dystrophy. Now they call complex regional pain syndrome, which people can end up having problems, and it's almost a garbage can term. I don't really want to say that, but it's people just end up with like fibromyalgia. We really need to find out exactly what's causing that fibromyalgia, and make sure that we're looking at lab tests that they've maybe already had done. We can order some additional lab tests where we can start to look at neurotransmitters, and that's usually where most people are having problems with fibromyalgia. It's at that neurotransmitter level where they're probably having some issues here. And if we get the lab work done and find out exactly where they're at, that's all almost amino acids and things that they need to just add to their diet that can help, reduce and hopefully almost eliminate their symptoms. We're probably going to have to work with some of the muscles and all that sort of stuff to get it to fully resolve. But again, that's a whole nother podcast that we probably need to do here to cover that. But
going, stepping back into the rotator cuff and an injury. Now, when we look at it as a whole, our body needs to stay moving. So with an initial injury in that nature, what is the recommendation? Is it, let's hold it still for so long, let's take it out of us, sometimes we get put in a sling.
Almost any injury, yeah. You want to do the price or rice thing there. You want to protect it. You want to rest it. I would say, you want to keep it active, but, when you get a chance, if it's obviously hurting when you're moving it, because it's acutely inflamed yet, then yeah, you're going to have to, protect it and not use it to the point where you're aggravating it and just prolonging kind of the suffering with it there. But then also ice, to keep the swelling kind of under control. That's just the main thing there. It's like heat and ice do about the same thing, but when you have acute inflammation going on, you don't want to cause things like compartment syndromes or anything like that, or you don't want to add too much blood flow to an area that is already inflamed, because now you're just making it probably more worse rather than having it get better. And usually it's that first 24 hours to 72 hours, or the first 1 to 3 days where we really want to be protecting it. But soon after that, if it's starting to feel better here, you need to start moving it as soon as possible. And it might be just a little bit. I always tell people to start to focus on like just 1% better, each day. So it might be, hey, maybe I can take my hand and, if it's a rotator cuff and you had it in a sling or something like that, maybe you can take your hand from the sling and raise it up to your mouth. Or maybe it's not even that far. You can raise it up to reach for a pocket or something like that. And just move it as through a pain-free range of motion as you possibly can here, because that's slowly going to help you gain and not lose any of that range of motion while that's healing. So,
yeah, I think that's just good to note, because most people are, oh man, it's in a sling, I got to keep it there and not use it, but we know, and now you all know, that we need to stay moving.
And then kind of to finish off that whole acronym there of like price would be to like compression. And that's where we can use things like kinesiology tape. We'll add some kind of compression on that area there. And then elevation, with a shoulder or rotator cuff type injury, you're probably going to be, you might have to sleep in a recliner or something like that for a little while until it all completely kind of calms down. But an interesting thing with shoulders is that it can hurt for a long time. I've separated both my shoulders, and they didn't have MRIs back then. Did I damage some of the rotator cuff? I might have. I don't know. I did have a lot of pain with it, and it took a long time for it to fully get to a point where it didn't hurt. But there wasn't a lot of people back then that had a lot of knowledge of how to and what to do, even though I had exposure to college athletic trainers. Even they were kind of, I'd say, clueless. I would have hoped that they could have done a little bit better job, but it just seemed like they didn't get any answers from anybody. And really it was nobody. I did have a chiropractor that we worked with, and, he was probably pretty good with a lot of things there, but still, when I separated my shoulder, still wasn't a real good, strong suit there. Medical-wise, here's more ibuprofen, there just wasn't a lot of help there. I think that's why even myself, once I got into chiropractic college, I guess I chose chiropractic because it was a profession that, one, I can get licensed in all 50 states. I looked at naturopathic school. Wasn't something that was going to happen there because they were licensed in about 6 states. But it was also more for some of the sports injury type stuff too. And once I got into school and really started to focus on that, it's like there's a lot that we can do to help people out if you really, focus on it, because you're not going to get a lot of the things that we do in the office here. There's such a somewhat fixed mindset in that they tend to compartmentalize things on areas. So like a rotator cuff injury, it's like, oh, we need to look at your shoulder here. And that's all they're going to look at is your shoulder. When chiropractic-wise, they're like, oh, let's look at your neck. It's maybe some of the nerves that are coming from there. And we definitely need to look at that too. But we also, you get into the shoulder, there can be problems not only with, the rotator cuff, which is just the muscles that help control the head of the humerus, which is the big bone in your upper arm. But you could have problems with your clavicle. You could have problems with your shoulder blade. And if you don't address those, the problem's just not going to get any better. And it wasn't until, I myself went into the Certified Chiropractic Extremity Practitioner program there, where we started to look at things more from a kinetic chain standpoint rather than compartmentalizing things like I learned when I went through a certified chiropractic sports practitioner program. And that made a ton more sense to me. And now all of a sudden, we're getting high 99% of people better because you can look up the chain or down the chain and find where the problem's at and get to the root cause and get it resolved for people rather than just compartmentalizing it and getting too microscopic on the area there. And when looking at it more macroscopically and like I say, through the kinetic chain, which is how your body moves, we can get to that problem resolved and people can kind of get on with their lives and actually start to function normally again.
I know those extra areas that we can check and make sure are functioning properly so the shoulder can heal is a big bonus. Most people tend to say, oh yeah, my shoulder hurts. I go in, get my shoulder checked. Okay, well, what's happening above or below or around that area?
Or are those areas even involved? And it might be just your shoulder. That's very, very possible. But, especially football injuries where you can damage the rotator cuff there as well. You land funky on your arm. You dislocate your, humerus. You separate a shoulder. I had a patient come in and, they got kind of crunched sideways in between two rather large linemen and broke their collarbone. And, just the way your body compensates too. I mean, and how it tries to maintain normal range of motion. And it'll just make other areas work more than the original area there because it wants to maintain a normal range of motion. Mm-hmm. And once we get that resolved and get everything kind of working correctly again, all of a sudden it's like all the pain really disappears because you're not overworking areas or underworking areas. We're getting everything to kind of function normally again so you get back to your full potential. I mean, that's why I have that as a, part of the tagline for the office here is we want to help people reach their full potential, so that they, can live a fulfilling life too.
Mm-hmm. Those shoulders, I tell you, they're a weird joint. It just kind of hangs there.
The shoulder, I mean, it's the most mobile joint in the whole entire body. I mean, should have a full 360 degrees of circumduction, meaning your arm can swing all the way around. It's your rotator cuff muscles that help stabilize that. So, again, if you think you have a problem with your rotator cuff muscles, give the office a call. You can always come in for a complimentary consultation, so there's no obligation there. I know we're actually going to even have a new online form where you can kind of fill out so we can see before you even come in how it's affecting, most of the activities in your daily life here, whether that be the sport that you're in or your work activities or hobbies that you even do. When we can sit down with you, we can give you a good idea then of what we maybe need to do yet diagnostically to try and narrow down exactly what's going on with that shoulder. If you've already had some of that stuff done, making sure you bring that stuff in so we can look at MRIs, CAT scans, even lab work for different things. And then we can give you a pretty good picture of, hey, can we help you out here or not? If we can, we'll let you know what it's going to take to get better there, as well as even what the cost might be that you might have to pay out of pocket, as well as what the total care will cost you there too. So we try and be upfront with everybody here so that there's shouldn't be any questions, and you always get to decide whether you want to follow through with treatment or not. So
absolutely. Wow. Any last words?
Don't let your rotator cuff hold you back here. Mm-hmm. There are other solutions here. There's not too many rotator cuff conditions unless it happens to be something that is a complete tear, which is kind of a rare situation. But I think you might be surprised if you come in just how much better we can get it here. And there's a lot of things you can be doing at home that don't require any equipment at all that we can get you doing to help start to strengthen and stabilize that, even if you don't need treatment here, so that you can keep it strong and healthy and you can, live a full life and reach your full potential by, doing all the things you love to do. So,
yes. So, if you have a shoulder injury or someone you know, and you don't want Dr. Bekkum to dig in too hard later down the line, make yourself an appointment, call in, again, a free consultation on the shoulder and any area of the body, and we'll get you moving in the right direction.
I hope that was helpful, and we'll see you next week on the next podcast.
Beautiful. Bye-bye.
Thanks for listening to the Extraordinary Health Podcast. For further information or to set up an appointment, go to the website at www.allseasonsintegrative.com or call us at 701-356-0016.